Doctors and nurses at Erie County Medical Center are working hard to make sure that assault victim is safe and stable.
This is part of a case that we usually can't show you, but this morning, hospital staff letting us inside the emergency room as we tell their stories. 7 Eyewitness News reporter Tweelan Nugent there live. This is part of our Overnight Hero series. Good morning, Tweelan.
Good morning, Ed and Katie. I'll tell you what, whoever is brought through the doors of this ER is in good hands. The staff in this department works 12-hour shifts, just like these residents right here. And during that entire time, they are literally ready to go within seconds of a patient coming in. And we saw all of that firsthand.
No worries. Don't be scared, you're in good hands.
The good hands of the staff inside the emergency department that have been trained to work when every moment counts.
Overnight, we see some more critical patients in terms of accidents or assault. So we'll see a lot of gunshot wounds or stabbings. Some nights we have a ton of patients. Some nights it's a little bit slower.
We are surrounded inside ECMC's emergency department by doctors, residents, nurses, and technicians taking care of 17 patients admitted through the night.
No head injury, no loss of consciousness. No.
The patients were in from anything ranging from back pain because of a fall to a heroin overdose. Just seconds into our interview with Don Giordano, a clinical research nurse in charge of training, our first trauma of the night came rushing in.
What's the ETA? 3 minutes. It's coming up on the ramp now.
The patient, a victim of assault, quickly wheeled into a trauma room. The room swarming with staff, but each person inside knows exactly what to do.
One person's managing the airway, one person's managing IV access, somebody's putting them on the monitor, somebody's obtaining vital signs.
After a quick assessment,
no contusions or brain.
The patient is wheeled to get a CT scan to check for internal injuries, then to X-ray to check for any broken bones, and the staff kind and reassuring each step of the way.
All right, let me give you this meds, buddy.
This one trauma, a model for how every patient is treated.
Our goal at ECMC is to approach every trauma in the exact same way.
And of course, I had to ask, how similar is ECMC's ER to our favorite medical dramas like Grey's Anatomy or The Good Doctor? Well, the biggest difference here is that the doctors on TV, well, they'll dabble in everything and follow a patient all the way through. But here in a real ER, each doctor kind of sticks to their specialty. So there's a lot of people in the room, as you can see. We're live in ECMC. I'm Tweelan Nugent, 7 Eyewitness News.
I'll tell you, I don't ever think I've realized how much work goes into stabilizing a patient like that. I have the utmost respect for doctors and nurses and all the folks at these hospitals because they are working so hard to keep us safe.
Everybody knows their role, everybody plays their part, and they keep everyone safe.
It's fascinating. Thank you, Tweelan.
Awesome.